Warning, this content may be upsetting or disturbing to some audiences. A kid is awoken by intense pain and a scratching sound in the ear? Usually a cockroach. Doctors, what still makes your skin crawl? I'm a trauma surgeon, so blood and mangled bodies doesn't really faze me, but full body skin conditions do. Things like eczema, herpeticum and Norwegian scabies make me itch all over and are really uncomfortable. It's where someone who has eczema and bad immune system gets infected with herpes, and it spreads to all the broken skin. Basically their entire body is covered with herpes. How cruel people can be. Dealing with disease is one thing, but dealing with victims of any kind of assault, domestic violence or mass tragedy is chilling to the bone. Large parasites that live in the skin. I can deal with worms in the organs, or microscopic spiders living in my face pores, but when it comes to scabies or botflies I wanna claw my own skin off. Fun fact. You currently have hundreds of tiny spider mites living in your face pores. I can handle skin sloughing diseases, gore, and meth head tweakers just fine. But hell, I hate parasites. Bedbugs, scabies, tapeworms. Fun fact, you can end up with tapeworm eggs in your brain if you have tapeworms and your hygiene is rank enough. I'm a parasitologist and any type of intestinal parasite or blood-feeding parasite doesn't bother me at all. But the things that really make my skin crawl, literally in some cases, is bedbugs and larvae which form from eggs laid under the skin. Botfly larvae are my biggest fear. Also, you don't get the actual tapeworm eggs in your brain, you get cysts which are full of juvenile worms. The eggs are passed out in infected people's poop. But the cysts cause a super nasty disease called neurocysticercosis which causes you to have seizures and the parasite can eventually infect your eyes. Scary stuff. Not a doctor, but I was a combat medic in the Army infantry with several deployments to Iraq during the war. Interestingly enough, I dealt with a lot less gunshot wounds than I thought I would, all things considered. I guess the body armor they issue really works. There was a lot of trauma from explosives though. Anyway, I was fairly immune to most injuries I encountered, including a pretty bad head injury with exposed brain matter. He lived, by the way. But one thing that will always make my skin crawl just to think about it is burns. Especially full body burns. I'm always grateful that I never had to be on scene when treating severe burns, but I did work in several aid stations and a hospital stateside that received and treated people with third-degree burns covering most of their bodies. Thank God or whatever that these injuries were far less common than others, but if you ever meet someone who said they were a fueler in Iraq or Afghanistan, they had what was potentially one of the most dangerous jobs in the war. Fuel trucks don't mount armor. Very little does. I can see blood, guts, death, and very little phases me. But watching any video of somebody breaking a bone gets a big nope out of me. All the creepy crawlies living where they shouldn't be. The more slithery the worse it is. A kid is awoken by intense pain and a scratching sound in the ear? Usually a cockroach, not so bad, but a hassle to remove piecemeal leg by leg if it comes to that. Some guy is complaining of nasal congestion and some bleeding months after a vacation? Yup, leeches in the nasal cavity. I'm never going swimming in any rivers ever. Diabetic patient complaining of a non-healing wound behind his ear? I scoop out dozens of maggots from underneath the skin flaps and they're falling on the patient's stretcher. A pregnant patient admitted for delivery is complaining of itching down there after maybe straining a bit too much? An Ascaris roundworm is poking its head out the butt and saying hello. Always makes me gag when I have to be the one to remove them. I can't even see or hear the phrase, Fournier's gangrene without cringing. Don't Google image search that at work, unless you also work at a hospital. Also, I really don't like going into patients' rooms when they have bedbugs. Even if I gown and glove before heading in and only touch them to do an exam, I will have phantom itching for hours and then change clothes in my garage when I get home because nope. For me it's nasty teeth. There are very few things that move me in any way, medicine or otherwise, but nasty teeth. I could never ever be a dentist. My friend works in emergency medicine and can't stand hand wounds. She's the toughest lady I know, but hand wounds make her swoon like a medieval maiden. Among other doctors I know, it's usually skin conditions and burns. The common thing we all hate is abuse. ITT prediction, not a doctor, but my brother is, and he always says the way a lot of elderly people are treated really gets to him. Sometimes by their carers, sometimes by children and other relatives. Often he talks about people hanging around like vultures, waiting for them to die so they can get their inheritance. Obviously this isn't the case with all elderly people, but it's common enough. I work at a maxillofacial surgeon's department and I've seen a lot of procedures which don't faze me: teeth extractions, upper and lower jaw realignment, traumas of all types. Broken jaws, broken orbital sockets, oncological procedures, explorations. The lot. But there's one procedure that makes my gut wrench: rhinoplasties. There's something about that open nose, and people cutting and prodding around that makes me so uncomfortable. I don't know why. Not a doctor, but a former funeral professional. I've seen and smelled and handled the goriest of gore in my day, but I still can't stand cleaning out someone's nostrils and getting crusty boogers out. Hork. Any injuries to nails just make me go weak. Fine with eyes and all the other stuff that usually messes people up, but nails? Ugh. When I was a student, I was watching something have finger surgery under local anesthetic. Finger was numb, surgeon was prepping it to cut and had this little tool in his hand. Suddenly rams it under the fingernail and hoiks it off. Reg. Prion diseases. I don't love blood veins and arteries, but I can deal with them. Poop, pus, gore, I can handle it all for the most part. But I thought about prion diseases and what they do to you too much the other day and almost passed out at my desk. I don't know why, but the thought of them just makes me queasy and lightheaded. Just typing this is starting to have that effect. A short description is that they're misfolded proteins. If you Google it, you aren't going to come up with any gross images. They don't typically distort you from the outside. Prion diseases are common in cannibalistic tribes, especially in women and children, and they are often who would eat the brains of the people they consumed. Certain prion diseases are colloquially known as zombie disease because you can get it from eating human brains, and the symptoms often lead to wanting to consume more human flesh, among other things like tremors, uncontrollable laughter, etc. That's just one example of prion disease. Not everyone infected with prions will want to eat people. So yeah. It makes me squeamish reading about them. And the other terrifying thing is that prion diseases are often fatal. Fatal familial insomnia is one you might have heard of, and if something has been contaminated with prions, you essentially have to destroy it and throw it out because prions are nearly impossible to kill and can live outside of the human body longer than a lot of other things that can kill us. Not a doctor, but I've worked in medical education and policy for 12 years, so there's very little that grosses me out anymore. But a while back I sat in on a wound care educational activity that was case study based. The second case study was a post-surgical patient where a combination of refusing follow-up care and supermorbid obesity had caused wound separation underneath a fold of fat on the abdomen. This person was like 2 years post-surgery and had an open wound festering in a massive, wet, bacteria-ridden crevice of their body. Just typing that out almost has me dry heaving. It was the most disgusting thing I have ever seen. The doctor teaching the course waited until everyone had made uncomfortable noises and then said, "Now imagine the smell." No, thank you. The photos are enough to haunt my nightmares until the day I die, hopefully not from a festering wound. Dentures. Especially gunked up dentures that aren't in the mouth. The other day, I was talking to an elderly lady on ward round. I was holding her hand as I am wont to do with my frail elderly patients, especially those with dementia or delirium. For some reason, she suddenly decided to remove her top dentures with her other hand and plonked them on the table in front of her. I spent the rest of that discussion with my hand in some kind of vice-like grip, being slowly but surely inched towards the dentures while I tried desperately to resist. Every now and then, she would stroke my arm with her still damp right hand. Anyone working in geriatrics knows the horror of the unexpectedly moist examination, but urine, feces, vomit, blood, snot, sputum, saliva, etc. I can easily take in my stride. However, dentures definitely turn my stomach. 6 years ago, in the summer of 2012, I job shadowed an orthopedic surgeon who specialized in hand surgery. He was a great guy, and over the course of the summer, I saw some truly heartbreaking cases, as well as several cases of miraculous and happy recovery. I have so many stories from that summer. However, one always stands out. A story told to me by the grandfather of a patient. I sat very still and listened to this man's mournful story, growing increasingly filled with rage and dark, oppressive sadness. At that day, in that room, I felt the world leak a little bit of its light, forever growing darker. I have never been a violent man, but after hearing his story, I wanted to beat someone to death. Pound my fists into them over and over as they screamed until they no longer breathed. The story that man told me about his granddaughter. I've shared it with very few people in my life face to face, because most of them can handle it. I'd like to share it with you. That day, by all accounts, was a beautiful day. We had seen several patients, mostly me quietly listening in the corner of the room, occasionally asking questions. I was there to learn after all. We had seen your typical orthopedics fare, broken bones, dislocations, carpal tunnel, etc. Then, we walked into a room with an elderly man and his young granddaughter. I was curious why the parents weren't here, but I didn't think much of it. If I had guessed, I would say she was about 6. I was wrong. This child was over 10 years old. Sitting in her wheelchair, she looked so small, so fragile. The desk on her electric wheelchair was covered in unicorn stickers and small plastic toys. As a line of spittle dripped from her lower lip onto her bib, my heart went out to the grandfather. He was here, taking care of his granddaughter, who would never be a functional adult. She was nonverbal and severely mentally handicapped. She groaned and cooed at us occasionally, but that was about it. She was perfectly content to play with her small horses and dolls, toys she should have outgrown years ago. Now, something many people don't realize is that the hands of many mentally handicapped people curl inwards towards their elbow. You've probably seen it mentioned, or maybe even joked about, in movies or TV shows. The thing is, this isn't just like a comfort thing for them. They have no control over this. The muscles in their forearms are permanently and severely cramped. Imagine one of your muscles cramping so hard every day that it is impossible to stretch the joint the other way, no matter how hard you try. This little girl had that in both of her forearms. She would pick up her toys by pinching them sideways between her first and second fingers, holding them on the backs of her other fingers. We asked the grandfather why he had come to visit us today, and it was clear he was struggling. He looked so tired. He only wanted to help his granddaughter, and after visiting countless other doctors and pursuing other options, he had finally come to the doctor. He asked the doctor to perform surgery to sever the tendons in her wrist, to give her some relief and give her more mobility in her hands. You may think this is cruel, but I promise you it really is not. She had so little use in her hands and she was clearly in pain. All he wanted was to help. The driver was a very sympathetic man, and was willing to perform the surgery. He just wanted to make sure other options had been pursued, so he began to ask the grandfather a number of questions. Over the course of the questions, 2 questions in specific came up. The answers to those questions shook me to my core. The first question was where the little girl's parents were. Why was the grandfather bringing her to the doctor? The grandfather described the girl's father as a piece of crap. He was an alcoholic and drug addict who didn't give a damn about his daughter's life, and the grandfather had stepped up to take care of her. The father was in jail, and the grandfather seethed with rage, telling us he hoped the father died in there. The second question, the one that broke me, was what illness did the girl have? Questions like this are necessary for proper treatment. Did she have a severe form of autism, or maybe Downs? Now, a profound sadness settled over the grandfather's face. A brokenness so severe, I can imagine the looks on the faces of the prisoners at Auschwitz who had seen their loved ones die. He looked up at us, with tears in his eyes, and said, "She's not sick. She was born a perfectly healthy, happy young girl. She was so bright, and so full of pureness and joy. She was in the top 25% of her class. Until that day. 2 years ago, her father's alcoholism got to its worst. He came home from a bar, and there was conflict. I still don't know what happened, or what caused it, or what could have prevented it. I may never know. But the forensics experts told me that he punched my daughter so hard that she lost her footing, and her head hit the counter. I hope that's when she died. But that monster continued to beat her anyways. When I had to go identify her body at the morgue, I couldn't. I could only tell it was her because of her ring. A small flower on her pinky finger that my granddaughter had given her." Apparently, the grandfather said through a gasping sob, one life wasn't enough for him. So he turned on his own daughter. He looked at the granddaughter, who cooed lovingly at him. He beat her to within an inch of her life. He beat her so severely that he permanently damaged her brain. He broke my beautiful baby. That monster did this to his own daughter, my granddaughter. I hope he dies in the most horrible of ways and rots in hell forever.